Since the recommendations changed, we've received emails, including this one, which reads, "With the new guidelines, I would not have needed a mammogram screening, and I almost didn't. Thank God I did." The woman who wrote it had the screening, and it found breast cancer. Cases like hers compelled us to revisit the guidelines.
In a fast-paced world, big directives sometimes boil down to what stands out, like a red car in traffic. With mammograms and when to get them, the age is what people see and hear.
I am afraid that women are going to look at that and think that they don't need a mammogram.
Dr. Deepa Halaharvi is talking about revised guidelines that confused patients, even some physicians. Take this doctor who represents the American Cancer Society.
I thought we were still screening at age 40 and going up.
Not quite. The ACS now suggests women of average risk should begin annual screening at 45. The U.S. Preventive Services Task Force reiterated its recommendation to do biennial screenings starting at 50. Did you think you needed to get a mammogram?
No, I really didn't think I needed to worry about it. I thought, you know, at 50, I'm 8 years away from that. I've got plenty of time. I don't need to worry about it.
Then Sherry Lytle found a lump. Her doctor ordered a mammogram, which showed a growth. Further testing revealed stage 2 breast cancer.
It's a scary word.
It is
a scary word.
Even scarier to Sherry, if she hadn't felt the tumor first and relied on those mammogram guidelines.
At what point would I have found this, and at what point would I have been tested? If I waited until I was 50 for a mammogram, I might not even have survived that long.
Breast cancer surgeon Dr. Halaharvi has wondered the same for herself. A mammogram revealed she had her own battle to fight when she was 42. She questions waiting past 40 to start screenings.
They need to reevaluate the guidelines that they came up with. 25% of all women who die of breast cancer are in their 40s. So it absolutely does not make sense, these guidelines, whatsoever.
But people who back the age 45 or 50 recommendations say they're not one size fits all. They don't rule out mammograms for younger women.
It is understanding that there's value to beginning screening in the 40s, but that women should understand both potential benefits as well as potential harm.
Like false positives and overdiagnosis that could lead to overtreatment. They say that science should be part of doctor-patient conversations about mammography. This patient, though, doesn't think that's clear enough.
There needs to be a clear, defined message so that there's no confusion and people aren't waiting when they shouldn't be waiting.
And Sherry's prognosis is good. Now, wading through all of this, physicians at OhioHealth and the James recommend screening at 40. Komen endorses mammography as the best available tool for detecting breast cancer and urges women and their healthcare providers to decide individually. The ACS and USPSTF say their recommendations are rooted in science and research, so the guidelines hold. But they believe women should have the option to begin screening at 40 and should speak with their doctors about it, and that really is the big takeaway here. You need to be your own best advocate. Regardless of the numbers, you have to have that conversation.
That's right. Thanks, Kristyn.